Hello, my name is Ashley Bozanak, and this is my video presentation comparing the U.S. healthcare system with Iceland's healthcare system. First slide will discuss health statistics and cost. First is life expectancy. In Iceland, for men, life expectancy is 80.6 years, and for women, 84 years. They're ranked 5th in the world with this number. In the USA, average life expectancy is 76.4 years for men, and for women 81.2, which ranks 33rd in the world. In Iceland, the top major illnesses are coronary heart disease, lung cancer, and stroke. In the USA, the leading cause of death is heart disease, cancer, followed by stroke. Mortality rate in Iceland was at a max of 21.3 in 1960 and at a minimum in 2011 of 2.5. This is per 1,000 live births. In the USA, 6.15% per 100,000 live births is the mortality rate. Percentage of GDP, which is gross domestic product in Iceland, is $14.6 billion. This is $42,351 per capita. In the USA, $17.02 trillion is our GDP, followed by $53,468 per capita. Next slide is healthcare financing. In Iceland, healthcare is funded by a general tax revenue that everyone pays. There are no private insurances unless you are a non-resident, in which they have programs for. You have 6 months to become part of the government health insurance at that point. Any out-of-pocket expenditures have a cap on them. These caps are determined by age, employment, and health status. There's also low income protection for pregnant women and children. In the USA, healthcare is financed through Medicaid, Medicare, and private insurance. These companies are funded by payroll taxes, premiums from private insurances, federal tax revenues, and state tax revenue. Private insurance covers up to 56% of our population. 16% are uninsured at this point. There are no caps for any out-of-pocket expenses in the United States. Both healthcare systems are part of the Commonwealth Fund, which encompasses a few other different countries, and this regulates financing and healthcare standards throughout the world. Next slide is healthcare administration. Healthcare administration is carried out in Iceland through the Commonwealth Fund and also the Ministry of Welfare. The Ministry of Welfare is regulated by the government and is very in-depth and very expensive. In the USA, the United Nations and World Healthcare Organization are part of the government funds. NGOs, which are non-governmental organizations, some examples are Save the Children, World Vision, and Project Hope, to name a few. Other forms of administration are partnerships, such as Stop TB and Rollback Malaria. There are also development assistance agencies, such as the World Bank and USAID. Also, some foundations that help fund healthcare associations are the Bill and Melinda Gates Foundation, which helps children in need as well as pregnant women in need and other people that don't have access to good healthcare. Healthcare personnel and facilities. In Iceland, there are 2 main hospitals, the National University Hospital of Iceland and the Akureyri Hospital. There are also 10 different institutions. There are 7 different districts which cover the 8 regions of Iceland. These are divided into clinics, institutions, and hospitals for different specialties and levels of care. In Iceland, the doctors are paid by the government. There are very few doctors per town, so the citizens must register with a general practitioner, or they have the option to see a self-employed practitioner. Most of the registered nurses in Iceland work for the government hospitals. Only about 18% are employed by a private sector. In the United States, healthcare facilities are largely owned and operated by private sector businesses. 62% of the hospitals are nonprofit, 20% are government-owned, and 18% are for-profit. Some of these facilities include urgent care centers, private practices, outpatient centers, as well as surgery centers. These are a good alternative for hospitals and emergency rooms for acute care. Most doctors in the USA are paid by the hospital they are employed with or bill insurance companies privately. Throughout the United States, there's a wide variety of healthcare professionals, such as LPNs, RNs, scrub techs, as well as other specialties. The largest percentage in the United States are RNs, and there are about 700,000 RNs employed and licensed. There are over 400,000 licensed doctors in the United States currently. Access and inequality issues will be discussed in this next slide. In Iceland, there are very few inequality issues as well as access disparities. 100% of the population has insurance available to them. This is covered by the simple tax and reasonable out-of-pocket expenses. This is distributed by the government and also regulated. In the USA, options for insurance include private insurance if you're eligible and if your employer offers it. There are also the government programs mentioned before, such as Medicaid and Medicare. The newest option is the Affordable Care Act. In the Affordable Care Act, the benefits are that it ends pre-existing condition exclusions for children. It also keeps young adults covered, so if you're under 26, you're eligible to stay on your parents' health care plan. This act also ends arbitrary withdrawals of insurance coverage, so they're not able to cancel you just because you made a mistake. It also guarantees your right to appeal. You now have the right to ask that your plan reconsider its denial of payment. As far as cost goes with the Affordable Care Act, it ends lifetime limits on coverage. It reviews premium increases, so now that they can't increase their premiums yearly. It helps you get the most from your premium dollars with no administrative costs. It also covers preventative care now with no cost to you, which usually means a $0 out-of-the-pocket expense for a physical or for an annual pap smear, different preventative types of care. And it also removes emergency service barriers, so now you can go seek emergency care outside of your network if you have to. 43% of Americans receive insurance through their employers. Medicare covers about 20% of our population. The percentage of Americans without health insurance continues to fall with the Affordable Care Act, measuring at 15.9% so far in 2014, compared with 17.1% in the fourth quarter of 2013. Other health insurances can be paid in full by a family member, are covered by military or unions. This is my list of references used to create this PowerPoint. Thank you very much.